Hello, everyone, and welcome to this first in a series of webinars that I'm going to provide, the Pioneers of Healthy Lifespan and Longevity series, featuring some of the pioneers that really helped pave the way to our understanding of healthy lifespan and longevity. We owe them a great debt of thanks, actually. So thank you for joining. I think you'll enjoy this. I'm going to get started right away, so we try to keep to our timeline today. Remember that you'll get a copy of these slides at the end of this webinar. And if you have any questions, you put them in the chat box. When the webinar's over, I'll be happy to address them and stay behind a bit longer for those who want to stay. So this is Dr. Karl Folkers and CoQ10 research. These are pictures of Dr. Karl Folkers. And regarding our understanding and appreciation of Coenzyme Q10, we owe him a great debt of thanks. He's a U.S. citizen. His last professional post, he was at the University of Texas in Austin. He taught at the medical school there. But in 1957, a colleague of his named Dr. Fred Crane at the University of Wisconsin isolated a yellow substance in the hearts of cows, didn't know what it was. He sent it to Karl Folkers, who at that time was working for Merk Pharmaceuticals. And in 1958, Dr. Folkers discovered this chemical structure, which they called CoQ10. And some preliminary studies led him to believe that it could be very important in terms of cardiovascular medicine, which it turned out to be. As reported in the Journal of Nutritional Disorders and Therapy on June 2nd, 2017, during the final phase of Dr. Karl Folkers' career, he dedicated himself to the study of CoQ10, publishing over 300 research papers on this subject. He really was the pioneer in this area. And I had a chance really to indirectly have contact with him. In the 1980s, a friend of mine who was a medical doctor, his father developed congestive heart failure. He was in intensive care. They told the family he only had a few days to live because his heart was not responding to the medication. There's nothing that can be done. And so my medical friend phoned me and said, "You're a nutrition guy. What do you think about giving my dad CoQ10? Do you think that would be helpful in any way?" And I said, I don't know. I've seen some studies on CoQ10. I have no experience with it. At least I didn't at that time. But he went to the hospital. His father's in ICU, really deteriorating quickly. Said to the attending doctor, "I want to give my doctor Coenzyme Q10 just to test it out, see if it could help him." And the attending doctor said, "Don't be ridiculous. You should have your license taken away for even thinking about something so idiotic. You think a vitamin is going to save your father's life? He has end-stage congestive heart failure." He said, "I just want to try it." He said, "Well, you can try, but nothing's going to happen." He phoned Dr. Karl Folkers down at the University of Texas in Austin. And Karl Folkers answered the phone. And my friend explained the situation. And Dr. Folkers just very calmly said, "Just give your dad, slowly build him up to 150 milligrams a day of CoQ10 in divided doses. You can take it a little bit beyond that, and he'll probably be fine." And my doctor friend said, no, my father is he only has a few days to live. I mean, it's a very serious, dire situation. Dr. Folkers says, just do what I'm telling you. He'll probably do really well. So he applied, he gave him the CoQ10, and within about 3 days, his father's doing better. Within a week, he's getting out of bed and walking around. Within 2 weeks, he's so much better. He leaves the hospital. He stays on that regimen, and then we sort of refined it beyond that. His father lived another 17 years, went back to his law practice, and had a very, long life. And so that was my first clinical experience with Coenzyme Q10. But it was because we had a chance to talk to Dr. Karl Folkers on the phone, and he was very kind and compassionate and gave us this advice that no doctors were giving at that time. So that was really eye-opening for me. Now, in 1958, Karl Folkers was eager to begin work on CoQ10 testing as a potential cardiac therapy, but the executives at Merck were not eager. So Merck sold the patent rights to a Japanese company. Now, it took the Japanese scientists another 10 years to figure out the fermentation process to make CoQ10 in large enough quantities that they could start putting into clinical tests. But then they started testing it over a number of years. And by 1976, they had enough clinical evidence from patients that CoQ10 was so effective
that they approved it as a drug in Japan to treat cardiovascular disease, and it remained one of the top-selling drugs in cardiovascular medicine for the next 20 years. And then statin drugs came along, which lower cholesterol, and they started to outsell CoQ10. But CoQ10 still remains a very popular drug in Japan for the treatment of congestive heart failure and high blood pressure and some other conditions. But determined to pick up his work on CoQ10 in 1968, Dr. Karl Folkers accepted a job teaching at the University of Texas in Austin as the director of their newly founded biomedical research facility. We spoke to him when he was at the University of Texas in Austin. And for the rest of his life, he spent it doing studies on coenzyme Q10, looking at its application in different types of health conditions. Now, prior to his work on CoQ10, he was already very renowned. He was the scientist that isolated vitamin B12. He also discovered the mevalonic acid, which is an important intermediate in the production of cholesterol and also CoQ10 synthesis. In fact, statin drugs work by inhibiting HMG-CoA reductase enzyme, which is involved in that pathway. He also helped to identify the structure of vitamin B6 and the structure of various antimicrobial compounds like streptomycin group of antibiotics. So he's already a really renowned scientist and researcher. However, all of the work he did on CoQ10 has been totally dismissed in the North American world and the European world to a large degree, simply because CoQ10 is not a drug. It's a natural agent that has tremendous application in health conditions, and so it gets marginalized, and all that work never gets spoken about. But in addition to recognizing its effects on congestive heart failure and high blood pressure and other cardiovascular conditions, he also published papers showing that it may have application for patients with HIV infection. CoQ10 also stimulates or enhances immunocompetence. And in people who are cancer survivors, CoQ10 appears to have some application in preventing recurrence. You can read about that research. I'll point you to those research papers shortly. But Karl Folkers lived to be 91 years old. He took CoQ10 as a supplement himself for most of his adult life. But he didn't take other supplements that you and I might be taking, but he took CoQ10. He's truly the father of CoQ10 research. We owe him a great debt of thanks for opening our eyes to this incredible natural agent. And I would suggest that you read the Dr. Karl Folkers story in its entirety as it was published in 2017. They had a feature article on him after his death a number of years later, and you can read sort of his whole sort of bio if you're interested. He's an incredible individual. But in terms of CoQ10 itself, remember it's a vitamin-like compound, looks a lot like vitamin K. And so you see that CoQ10 could potentially, if a person's on Coumadin or warfarin, sort of inhibit the effects of those drugs because it could sort of substitute for them. So one of the things to be aware of is if you're recommending CoQ10, if somebody's on Coumadin or warfarin, that if they take CoQ10, it could potentially act as sort of a vitamin K type agent and start to interfere with the blood clotting time. So they normally would give an anticoagulant like that to extend the clotting time, or the INR. Giving CoQ10 might pull that clotting time back. It usually doesn't, but it just has the potential to do so. So that's one of the things to be on the lookout for when you're recommending CoQ10. Is the person on Coumadin or warfarin? In that case, you want to make sure that they're testing their INR, their international normalized ratio, or their clotting time, to make sure that it's not interfering with the drug. But in today's world, CoQ10 has many applications, as we see from clinical studies, with respect to the prevention and treatment of congestive heart failure, high blood pressure, arrhythmias. Can decrease the oxidation of LDL cholesterol, making less atherogenic. It has immune modulating effects that may help it for cancer survivors. It has application in neurodegenerative conditions. Studies show it protects the lungs against ozone and other air pollutants. It's improved lung capacity in people who have chronic obstructive pulmonary disease, COPD. It's also a skin surface lipid that helps to protect free radical damage from sunlight damaging the skin, leading to aging and skin cancer. Also, it helps to mitigate the effects of statin drugs on causing muscle damage or myopathies that people often get if they're on statin drugs. And there's very impressive studies suggesting it has tremendous anti-aging properties because our CoQ10 levels decline as we get older. Putting them back in can help to maintain a lot of important processes. So in terms of cardiovascular health and function, you'll remember that CoQ10, where's my cursor? Here we are. That when your body's breaking down carbohydrates, it breaks glucose down to pyruvic acid. Of course, that then is going to enter the Krebs cycle and become acetyl coenzyme A. And as the intermediates go around the Krebs cycle, the hydrogen electrons are pulled off by NAD and FAD and taken to the electron transfer chain. And as they go down the electron transfer chain, you make ATP energy. But notice that you need CoQ10 as to deliver the hydrogen electrons down the chain. So CoQ10 in the electron transfer chain is a central component that helps to move the electrons down the chain from complex 1 down to complex 3, so you can ultimately make ATP energy at the end of that pathway. And so again, you see CoQ10 here in the working in this pathway to move the electrons down the chain. But about 2 to 5% of the electrons still leak out of the electron chain, form free radicals that can damage the cell, damage the mitochondria. And CoQ10 is actually also acting as an antioxidant to help decrease free radical damage there. So it's acting to move the electrons down the chain to produce energy, but it also is an antioxidant protecting the membrane against free radical damage. Now, free radicals can increase significantly after trauma to the head, like in concussions, or also where there's been damage to cytochrome 1, whether it's genetic or induced by environmental factors, that leads to Parkinson's disease. So more CoQ10 is required in these cases, in concussion, in Parkinson's disease, or any form of mitochondrial dysfunction, because those things lead to more rapid aging and decline. CoQ10 at higher levels are required to quench the free radicals associated with those conditions. So the role of CoQ10 in the mitochondria is that it aids in energy production. Without it, you're not going to make the same amount of energy. There's going to be an energy power shortage in the cell. It's also a fat-soluble antioxidant that protects the mitochondrial membrane from the free radicals that are often generated around the mitochondrial membrane, because if you don't quench those things, you end up with mitochondrial dysfunction, more rapid aging. The cell goes into senescence. It produces more inflammation and spurs on the development of cancer in related cells that already have been initiated. So by protecting that mitochondrial membrane, you help to preserve the mitochondrial function, preventing these things from happening. And when you preserve more of the mitochondrial membrane function, then the mitochondria can undergo mitochondrial biogenesis and regenerate new mitochondria that are healthy to keep your cells healthy and able to produce the energy they need to sustain themselves from one generation to the next. Even in the brain needs to keep replenishing its mitochondrial supply. CoQ10 becomes an important factor in maintaining mitochondrial integrity over your lifetime. But you see that what happens in the aging process is as our body makes less and less CoQ10 over time, especially in the liver, kidney, but as in the heart, man, the decline is very significant. So you see it again in this pattern. You see even by age 40, there's already a major decline in CoQ10, and it continues for the rest of your life. And other tissues are affected as well. But right now we're talking about cardiovascular effects. So if you look at the heart muscle itself, there's a big decline in CoQ10 in the myocardial cells as you get older. So now the heart can't pump with as much force. It's not protected against free radicals to the same degree. There's less mitochondrial biogenesis. Aging, congestive heart failure, high blood pressure, less nitric oxide production, increased risk of arrhythmia. All these things become the consequences. So how does the body make CoQ10? It makes it through the same pathway that you make cholesterol. So as you go down through mevalonic acid, which Karl Folkers discovered, that molecule, as you go down, you produce cholesterol, but this is also the pathway through which you produce ubiquinone, which is what CoQ10 is. It's also known as ubiquinone. So when people are on statin drugs and they're blocking this particular pathway to produce cholesterol, you're also blocking their CoQ10 pathway. So people on statin drugs need higher amounts of CoQ10, regardless of their age, because they can't make sufficient amounts. We'll look at that. So there are studies showing that as you give people statin drugs, their ejection fraction declines significantly because they can't make as much CoQ10. And then if you take them off the statin drug, the heart pumping mechanism gets stronger again because they can synthesize CoQ10 again. So drug companies will tell you that if you put a patient on a statin drug, they should also be on CoQ10 at the same time, at least 90 milligrams a day to help guard against the decrease in injection fraction. In fact, Dr. Langjuan, who's a cardiologist who's worked with CoQ10 for many years, in 2019 said, deaths attributed to heart failure more than doubled from 1989 to 1997. Statin drugs were introduced in 1987. So the interference with the production of CoQ10 by statin drugs is most likely the explanation that accounts for the rise in congestive heart failure during this period, because the heart is dependent upon adequate CoQ10 in order to generate the energy that it needs to prevent heart failure and to continue to function. So this but this gets neglected in the medical conversation with the patient. That's why it's important that it be on your radar. Now, with respect to congestive heart failure, it's the most common cause of hospitalization and rehospitalization for people over the age of 65. More than 5 million Americans, it's the most common diagnosis in hospitalized patients over the age of 65. 1 in 9 deaths has heart failure as a contributing cause. It's a serious problem. You want to try to avoid it, teach your patients how to avoid it. And if the person has congestive heart failure, just like my friend's father, they should be on CoQ10 as part of the adjuvant therapy, as you will see. Now, how do you prevent congestive heart failure? It's not just a declining CoQ10 that causes it. Smoking is a factor. You need to eat healthy, get the saturated fats and the bad fats out so you don't clog your arteries up. Get to your ideal body weight, reduce other risk factors for heart disease, get your blood pressure down, get your cholesterol levels in the ideal range. Even if that means using drugs to get your cholesterol down, you can't have clogged arteries. There's a chance you're going to get congestive heart failure or have a stroke or a heart attack. Having better cardiorespiratory fitness is also helpful, but it doesn't give you immunity against congestive heart failure. Some marathon runners end up with congestive heart failure. Supplementation with CoQ10 becomes an important factor to help prevent it. The evidence becomes stronger every year. There's a link to the most recent paper that I provided there. So in the Cochrane review in 2021, they looked at CoQ10 and heart failure treatment. They concluded that we looked at 11 randomized control studies involving over 1,500 participants. They were relatively small and followed up participants for a relatively short period of time. The analysis show that coenzyme Q10 probably reduces the risk of mortality from all causes, and hospitalizations due to heart failure. For the Cochrane people to say that, that's a big statement. Now, the thing I want you to know is that the herb known as hawthorn also contains active constituents, these flavonoids that it contains, that also help to improve energy function in the heart. So CoQ10 helps to make ATP, but hawthorn helps to make cyclic AMP. You need cyclic AMP to make ATP. So there's also studies showing that hawthorn is effective in managing congestive heart failure. When you put CoQ10 together with hawthorn, you get the very best possible effect. We'll come back to that. What about CoQ10 and atrial fibrillation? How common is atrial fibrillation? 9% of Americans over the age of 65 have this problem. So you get this discoordination in the atria. So blood pools and collects abnormally, it moves slowly, it forms clots, and you can easily have a stroke. Atrial fibrillation is the most common arrhythmia affecting elderly patients. 10% of those over the age of 80, and 70% of people that have AFib are between 65 and 85 years old. So what are the contributing factors to atrial fibrillation? As you get older, there's a greater risk. Family history, high blood pressure, obesity, sleep apnea. So the recommendations is limit your alcohol consumption, don't smoke, avoid overtraining. You can damage the heart by overtraining. And stay on alert for the signs of AFib. So what are the signs of AFib? They can be very subtle, just a fluttering heartbeat that seems to bother you from time to time, heart palpitations, lightheadedness, you feel winded when you're at rest. And then it can actually escalate into, real pounding. The person just knows there's something wrong. But as you get older, you should have ECGs on a regular basis to see if AFib is showing up. So what about CoQ10 and atrial fibrillation prevention? Well, a 2015 study showed that in patients with heart failure who are provided with CoQ10 supplementation, the development of AFib occurred in only 6.3% of patients compared to 22.5% of patients given the same drug treatment for congestive heart failure without the CoQ10. And congestive heart failure patients are very, very high risk for developing atrial fibrillation. And thus it's likely that CoQ10 supplementation helps to prevent congestive heart failure and atrial fibrillation as we age. And the same is true for Hawthorne. It also has been shown to have anti-arrhythmic effects. So these two things working together as you get older can help prevent not just congestive heart failure and high blood pressure, but a very common heart disorder, which is atrial fibrillation problems, which is a lot of my friends have this. This occurs as you get older. Now, there's two really important recent studies I want to bring to your attention because they really are hallmark studies that have been published in recent years looking at CoQ10 and in cardiovascular disease, specifically congestive heart failure and longevity. So the first one is the Q10 study involving Swedish elderly patients, and the other one is the multinational 9-country study called the Q-Symbio study. Let's look at these. So the Q10 study, it involved 443 Swedish citizens who were already 77 to 88 years old. They followed for 5 years with reevaluations every 6 months. They kept a close watch on these people. It was a randomized double-blind control study whereby half the subjects got 200 milligrams of CoQ10 or ubiquinone, right, every day. And they also got 200 micrograms of selenium. I'll explain why later. Throughout the trial, and the other half got the placebo, right? So they're all healthy to start with. And they're 77 to 88 years old. Followed them for 5 years. What happens? After 5 years, the group that got the CoQ10 and the selenium, 50% fewer deaths from cardiovascular disease. The blood marker for congestive heart failure, which is the NT-proBNP, is significantly lower. And the ECG studies show that they have better heart function, less risk of AFib and better heart function overall. At the end of the 5-year period, 12.6% of the placebo group died from cardiovascular disease, while only 5.9% of those taking the supplements died. That's greater than a 50% reduction in cardiovascular disease deaths in an elderly population. The researchers concluded, this is recently now, long-term supplementation of selenium and CoQ10 reduces cardiovascular mortality. The positive effects could be seen in the biomarker for congestive heart failure, which is the NT-proBNP, and also improved electrocardiograph findings. Moreover, the researchers quantified health-related quality of life outcomes. They used this questionnaire, and the results showed that the active group, not only didn't they get congestive heart failure and die or develop AFib, but they also had better quality of life scores and much less hospitalization. So this is remarkable stuff. So where does selenium play a role? Well, in Sweden, they have very low levels of selenium in the soil. So their plants that grow there don't have a lot of selenium, and people tend to be selenium deficient. So when you have severe selenium deficiency, you can get a cardiovascular condition called Keeshan's disease, where a lot of free radicals build up in the heart muscle. So to guard against that, they also gave them selenium. Now, here's the thing that's amazing is that 12 years later, they looked at the same cohort of people who were given the CoQ10 and the selenium, and saying even 12 years after the study ends, when we follow them up, this group is still showing significantly fewer cardiovascular deaths and hospitalizations. It's a remarkable compound, CoQ10. And the Q-Symbio multinational study proved it further. So in 2019, they published the results. They took 420 patients who already had congestive heart failure. They gave them 100 milligrams of CoQ10 3 times a day, exactly what Karl Folkers told us to sort of titrate up to with my friend's father. Followed them for 2 years. They looked at biomarkers for congestive heart failure. And they used CoQ10 as an adjuvant to standard medications. So they gave everybody the standard medication, but then they gave half the group additionally CoQ10. They didn't give CoQ10 by itself. They gave them the standard medications they would normally give, but they added CoQ10 to 50% of these 420 patients already had congestive heart failure. Then they did clinical exams on a regular basis, electrocardiograph, they did blood markers. And the endpoint they were measuring was how long was the person going to go until they had their first major adverse cardiovascular event, right? Like an unplanned hospitalization, worsening of heart failure, cardiovascular death. That's a major adverse cardiovascular event. Here are the results. The group that got the CoQ10 significantly reduced the relative risk of their major adverse cardiovascular event by 42%. With a reduction of both cardiac-related deaths and all-cause mortality in a high-risk group. The subgroup analysis of the effect of supplementation in the European cohort was even better. So the group in the European cohort, because it's 9 different countries that they're studying, but the European group showed much better compliance, because that meant that they were taking their CoQ10 as prescribed to them, and they were very vigilant about it. Whereas in other countries that were involved, some in North America and elsewhere, the compliance wasn't as great. But the group that had great compliance, the European cohort, showed an even greater reduction in mortality and cardiovascular deaths and progression of their congestive heart failure. So, and their blood levels showed that their CoQ10 was higher. So the group that was taking it on the right schedule, their blood levels of CoQ10 were higher, and their deaths were lower, and their cardiovascular complications were less. Incredible evidence. You take people who already have congestive heart failure, give them the same drug regimen as everybody else normally gets, and give this group to CoQ10, and you reduce deaths by over 50%. Remarkable stuff. Now, what I need you to know is that there's a lot of people out there saying that ubiquinol, that form of CoQ10, is superior to ubiquinone. Now, Karl Folkers used ubiquinone. In the Coenzyme study, they used ubiquinone. In the Q-Symbio study, they used ubiquinone. They didn't use ubiquinol. But you have these television advertisements, and you have these internet people saying that ubiquinol is the right form to be taking. It's a lot more expensive. That's why they're telling people to take ubiquinol, because the profitability is much higher. But studies have shown that it's not superior at all to ubiquinol. In fact, ubiquinone is the gold standard to be recommending. Most of the randomized control studies over the years have used ubiquinone, not ubiquinol, especially with cardiovascular interventions. And Karl Folkers, all those 300 studies he did, it was on ubiquinone. So don't be fooled by this quinol and ubiquinol story that you might see out there, thinking your patients need to spend more money on something more expensive. Don't get them to spend money on things that are more expensive unless it's necessary. With respect to CoQ10, it is not necessary. And if you read that research article, the review article in 2020, in the journal Antioxidants, you will see a complete report, and all the evidence is presented there that ubiquinone is actually the preferred form of CoQ10 for supplementation. It's important that you know that. Now, there's a fabulous review of all the major clinical studies using CoQ10 that's published back in 2008. If you want to do more reading on this, because I only have a short period of time with you today, but if you want to see the application of CoQ10 in all of these different conditions, it's reviewed beautifully in this research article. And the Life Extension Foundation has a great review also on its effects on congestive heart failure and arrhythmia. You'll see studies on the immune system function, studies on COPD. I provided all the links for you. I taught a webinar a couple of years ago on naturally reducing high blood pressure, and the CoQ10 Hawthorne evidence is in that webinar with all the references. At Adeeva, we make Cardio Essentials. It has CoQ10 with a standardized grade of Hawthorne and also quercetin to reduce blood vessel inflammation. My suggestion is that if you're over the age of 45, or you have a patient over the age of 45, get them just to take 1 capsule a day, just 1. That's it. There's 90 capsules in the bottle, lasts them 3 months. But once you hit age 60, I think you should do what I do and take 2 or 3 capsules a day. As I approach age 69 now, I'm taking 3 capsules a day. My blood pressure is 120/70, no sign of AFib. I'm very happy with what's going on cardiovascularly in my own health. People on statin drugs should take 3 capsules a day. So I've laid out certain things. We've had some patients that I've helped manage through some practitioners with dilated cardiomyopathy, giving them higher doses, but you need medical approval to do that. Remember that Hawthorne can interfere with digitalis, so you can't give them anything with Hawthorne if they're on the drug digitalis. You should also know that Cardio Essentials works best with the Adeeva multivitamin and essential fatty acids, because in the Adeeva multivitamin, you have the B50 complex to keep homocysteine down, very important for cardiovascular health. Also, folic acid with the other factors that you need to make ATP energy, pantothenic acid, niacin, riboflavin, vitamin B1, they're all important for making ATP. It's not just CoQ10. So that B50 complex is helpful. Also, the niacin helps to turn on these sirtuin longevity genes. And you also, with folic acid, helps to produce more nitric oxide, which is important for endothelial function. So a B50 complex is crucial. More antioxidants help to stop the oxidation of LDL cholesterol. That's also important. And calcium and magnesium in this product also helps to keep blood pressure lower. In terms of nature's essential oils, the omega-3 fats especially help with vasodilation, decrease platelet stickiness, decrease blood vessel inflammation, all important factors in cardiovascular health. So in the Adeeva multivitamin, you're getting calcium, magnesium, enrichment of antioxidants. You're getting the B50 complex, vitamin D at 1,000 IUs. 2 tablets twice a day for adults makes great sense. It eliminates them having to buy a whole bunch of individual products, and it works beautifully with Cardio Essentials. And so you see the whole formulation of the Adeeva multi there, that if you haven't seen it before, probably many of you are familiar with it. And then nature's essential oils with, fish oil, flaxseed oil, and borax seed oil. They work synergistically to slow the rate of cell division. That's important for anti-aging and cancer prevention. But for heart disease, you want to dilate those vessels, decrease stickiness, decrease blood vessel inflammation. You need those omega-3 fats to do that. Then you also want to have smoother skin, less inflammation in your body. For brain support, it's a deluxe supplement that people should take as part of a foundation program. Therapeutic applications for CoQ10, I've given you some dosages that make sense for therapeutic applications. But when the person has a serious health problem, of course, their medical doctor has to give consent. So I want to thank you for sitting in today. I really appreciate it. That's all our time. It goes by quickly. These are little 30-minute hits. I'm very grateful for you to be here today. So thanks so much.